Welcome to Aging Well in the Decade of Healthy Aging. In the spirit of reconciliation, COTA Queensland acknowledges the traditional custodians of the country throughout Australia and their connections to land, sea and community. We pay our respect to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people. I hope that most of you are familiar with Council on the Ageing, or COTA Queensland. We're a for-purpose registered charity advancing the rights, needs, interests and futures of Queenslanders as we age. We're part of a federation of COTAs, that is that there's a COTA in every state and territory, and COTA Australia, which is based in Canberra. Together we seek to achieve an equitable, just and inclusive society for Australia's over 8 million older Australians. Our vision is that ageing in Australia is a time of possibility, opportunity and influence. Today, I want to discuss why ageing matters. I'll provide some statistics because what is a PowerPoint presentation without statistics? I'll then talk about how ageing is changing. I'll focus on the United Nations Decade of Healthy Ageing 2021 to 2030. And then I'll cover off on some of the things that COTA Queensland is doing. But first, I want to encourage you to tell us about matters to you. That is, your experiences with COVID, health services in Queensland, social isolation and loneliness, housing, transport, etc. The issues that are impacting on your ability to age well. This week, the Queensland Government tabled the 2023 budget and will soon be asking you to contribute to our submission to influence their 2024 state budget. You'll be able to contribute through our engagement hub, www.cotaqld.engagementhub.com.au, or you can talk to one of the members of our policy team. At the end of this presentation, I'll put up our contact details. COTA Queensland engages with a diverse community voices to inform our independent evidence-based insights. We collaborate with local, national and international experts and networks to keep abreast of national and international research with the aim to create real and innovative impact. We invite you to join our community reference network because your voice matters. COTA Queensland is recognised by the Queensland Government as the seniors peak and provides advice on a range of issues relating to ageing and Queensland seniors, such as housing, transport, energy, concessions, etc. And I'll speak more about these later. We have MOUs or Memorandum of Understandings with the U3A Queensland network, which we helped to establish back with Griffith University in the 1970s. We recently signed a MOU with Probus South Pacific, and we've had a MOU with Local Government Association of Queensland for quite a number of years now, and have one with the University of Queensland, which is Australia's first age-friendly university. Another area of our work is planning and coordinating Queensland Seniors Month with the Queensland Government. Last year, Seniors Week was extended to cover the whole of October, beginning on 1 October, the UN's International Day of Older Persons, with National Grandparents' Day celebrated on the last Sunday of October. The 5 objectives of Queensland Seniors Month 2022 are to connect older Queenslanders to inclusive events and activities by producing culturally inclusive, intergenerational or lifestyle events and activities for Queenslanders within their own communities, to create opportunities for older Queenslanders to continue to participate in activities beyond Queensland Seniors Month, to challenge ageist attitudes and reframe the conversation around ageing, to enable older Queenslanders to live active and healthy lives with improved physical and mental well-being, and to enhance opportunities for older Queenslanders to continue to learn through community education, lifelong learning, and digital literacy. Demographers used to talk about age pyramids, but you'll see from the graph that the base is shrinking. The graph on the left shows population change in Australia from 1999 to 2019. The red is 1999. You'll see in the blue the increase in ages 55 to 59 and above. You'll also notice the decline in the younger people, 0 to 19. Turning to the graph on the right, which is Queensland's estimated population at 30 June 2020, there were approximately 800,000 Queenslanders aged 65 and over, with 169 aged 80 and over. There were 150,000 frail people, but not all of them were old. The Australian Bureau of Statistics estimates that by 2050, more than 1 in 5, or 22.1%, or 1.8 million Queenslanders will be aged 65 years or older. I've had the privilege over the past year to give this presentation to a number of seniors expos across Queensland and to highlight the regional differences. For example, recently I was in Bundaberg, where already 24.6% of their population is aged 65 or older, compared to 16.1% of Queensland's population. There's a real need for local government to step up to ensure that we have age-friendly environments. Our life course is also changing. This is how life was in the last century. The first part of our lives was spent learning. The greatest part, but not necessarily in satisfaction, was spent earning or working. And if we were lucky, we made it to retirement age. Now more humans are living longer than at any time in history. Global life expectancy has doubled since 1900, and continues to rise, but adding more years to life can be a mixed blessing. We also need to add more life to years. In the United States, demographers predict that as many as half of today's 5-year-olds can expect to live to the age of 100. We need to think differently about aging. The Stanford Center for Longevity late last year released a report, The New Map of Life. The new map of life calls on us to shift from a deficit mindset that laments the losses now associated with aging, whether it be health, mobility, financial security, independence, or social engagement. We've got to identify the gains that now go unmeasured and overlooked. In 2016, the World Health Assembly adopted the Global Strategy and Action Plan on Aging and Health with the aim of using evidence-based approaches to maximise abilities of older persons, grounded in the concept of healthy ageing, a rights-based response to population ageing. The World Health Assembly endorsed the proposal for a decade of healthy ageing in August 2020, and in December 2020, the United Nations General Assembly endorsed the UN Decade of Healthy Ageing 2021 to 2030. The opportunity to align global, national, and local policies with older people for older people. The start of the decade also coincided with COVID-19, which has disproportionately affected older people, especially those living in residential aged care homes. In January 2021, the World Health Organization released the Decade of Healthy Ageing Baseline Report, which addresses 5 issues. The first is it actually introduces us to healthy ageing, the decade's actions and enablers and the pathway to accelerate impact by 2030. It asks, where are we now? The report provided a first-time baseline for healthy ageing worldwide. It provided what improvements could we expect by 2030 and documented progress and scenarios for improvement. It asked, how can we accelerate impact on the lives of older people? It showed how older people and stakeholders can together optimise functional ability. And it also looked at the next steps, including opportunities to boost collaboration and impact by 2023, which is the next reporting period. So, what is healthy ageing? The World Health Organization defines healthy ageing as the process of developing and maintaining the functional ability that enables well-being in older age. And the baseline report notes that optimizing functional ability is the key to healthy ageing. The World Health Organization has further clarified the concepts and definitions of healthy ageing, identifying three components: functional ability, intrinsic capacity, and environmental environments. The optimising of functional ability requires inputs from multiple sectors and whole of government response to population ageing, with important roles and responsibilities for health in all policies. Each of the health systems functions, including stewardship, financing, resource generation, both human and physical capital, and importantly, service provision, and the integration of these health and social care. Developing and maintaining a person's intrinsic capacity, along with Lifecourse, was a positive connotation that builds up reserves, are additional keys to healthy ageing. Significant declines are closely related to care dependence in older age. And lastly, environments, where people live and conduct their lives. Environments shape what older people with given levels of intrinsic capacity can be and do. Environments include the home, the community, and broader society, and all the factors within them. Key domains relate to products, equipment, technology, the natural or built environment, emotional support, assistance and relationships provided by other people and animals, attitudes, as these influence both behaviour negatively and positively, and more broadly, and services, systems and policies that may or may not contribute to enhance functioning of older age. The Decade of Healthy Ageing focuses on what can be done for people in the second half of our lives. It addresses 4 areas of action at multiple levels and in multiple sectors in order to promote health, to prevent disease, maintain intrinsic capacity, and enable functional ability. One of those is around combating ageism. COTA Queensland is a member of the Every Age Counts advocacy campaign aimed at tackling ageism against older Australians. The vision is a society where every person is valued, connected, and respected, regardless of age and functional health. Since the mid-2000s, COTA Queensland has been promoting the World Health Organisation's Age-friendly initiative. Age-friendly communities are places where people of all ages can live healthy and active lives. These places make it possible for people to continue to stay in their own homes, participate in the activities that they value, and contribute to their communities for as long as possible. And it covers 8 domains that are interconnected. We worked with the Queensland Government on their Age-friendly action plan, which was formulated over from over 9,000 responses to a survey sent to people who hold a Queensland Seniors card. The action plan, which was launched at the 13th Global Conference on Ageing, which COTA Queensland hosted in Brisbane in 2016. And we are now working with the Queensland Government to develop the next seniors strategy. There are now over 1,000 cities and communities around the world who have joined the global network of age-friendly communities. Regularly, we talk with stakeholders, such as local government, about the 5 steps to being age-friendly. To access age-friendliness, to understand and engage with stakeholders, particularly older people, to partner and connect, to develop an action plan, and importantly, to evaluate, to understand how to measure and report on initiatives. The Decade of Healthy Ageing emphasises the central role of older persons and the need for strong collaboration to enable transformative change. Listening to the diverse voices and enabling meaningful engagement of older people, family members, caregivers, younger people, and communities to nurture leadership and build capacity for integrated actions across the sectors, to connect various stakeholders, share and learn from the experience of others, and to strengthen data, research and innovation to accelerate implementation. So to summarise, healthy ageing is a dynamic process embracing all older people and requiring a whole of lot society approach. The UN is seeking governments and other stakeholders to commit by 2030 to achieve meaningful and measurable improvements in the lives of older people, their families and their communities. Strong collaboration is needed for transformative change and requires the building of systems that allow leaders, scientists and civil society, including people of all ages, in a wide range of sectors, communities and disciplines, to ask and answer the basic questions, which includes, where are we now? What improvements could we expect and work towards by 2030? Are we on track? How can we accelerate impact on their lives of older people, their families and their communities? How can we accelerate impact on their lives? And how can we help? And what are the next steps? So what is COTA Queensland doing? Well, we're committed to enabling the voices of people living and working in Queensland, and especially those living in regional, rural and remote communities, to be heard as Australia transitions to a new aged care system, and in particular, the new support in the home aged care program. We've been trialling an aged care navigator in the Cairns and Hinterland region. This is part of an Australia-wide pilot program, and it's going to transition into the Care Finder program, which will be under the primary health networks, the PHNs. And we hope to be involved in that through the whole of Queensland. Recently, we were engaged to lead a consortium to recruit, train and support 2,500 personal care workers across Queensland to enable people to receive person-centred care in their own homes rather than prematurely moving into residential aged care. What we hear from older people is that they don't want to go into aged care, that they want to continue to age well in their own home, but they may need some assistance. And what we're hearing from service providers is that they found it very difficult to actually find a workforce. So COTA Queensland is leading a consortium to actually find 2,500 people over the next 2 years, to train them, to support them, and we'll be working with a team of volunteers to actually work with those trainees to ensure that what they're providing is person-centred care. We continue to amplify the voices of people as we age. We do it through our annual state budget submission, through making submissions to parliamentary inquiries, through participation in working groups, advisory and reference groups on health, energy, housing, transport, the environment, in fact, all of those issues that impact on the ability of people to age well. I invite you to stay in contact with COTA Queensland, to become engaged in our work so that you can influence how you can age well. You can either do it through our website. We have a 1300 number, 1300 738 348. I've invited you earlier to connect to our policy team through that telephone number or through our email, policy@cotaqld.org.au. And like just about everybody else, we're on Facebook, on LinkedIn, Twitter, etc. So please stay in contact, get involved in our work, because we're here to assist you to age well. Thank you.